Every 66 seconds, another older adult is diagnosed with dementia. By the time you finish watching this video, several more families will have heard those life-changing words. Most people assume memory loss is simply a normal part of aging. They blame birthdays, gray hair, or getting older. But what if that assumption is wrong? What if the real cause isn't your age at all? For thousands of seniors, the problem may be hiding in plain sight inside the medicine cabinet. A prescription filled years ago, a sleeping pill taken every night, an allergy medication bought over the counter. Medications that seem harmless may sometimes affect the very brain functions responsible for memory, focus, and learning. The most troubling part is that many people never connect the dots. They begin forgetting names, missing appointments, losing track of conversations, or struggling to remember familiar routes. Family members often say, "That's just part of getting older." In some cases, however, the decline may be linked to medications rather than aging itself. In today's video, we're counting down 9 common medications that research has associated with memory problems and cognitive decline in older adults. Some of these drugs are prescribed millions of times every year. Others can be found in almost every home, yet few people are warned about their potential impact on the brain. And be sure to stay until the end, because the #1 cause isn't a single medication at all. It's a hidden combination that may be far more dangerous than any individual drug on this list. The good news? In many cases, medication-related cognitive decline can be identified early and sometimes improved when the underlying cause is addressed. At number 9 is diphenhydramine, better known by the brand name Benadryl. Most people recognize it as a common allergy medication, but it's also widely used as a sleep aid because it can cause drowsiness. What many older adults don't realize is that this medication may affect an important chemical messenger in the brain called acetylcholine. Acetylcholine plays a critical role in learning, attention, and memory formation. Think of it as one of the brain's communication systems, helping nerve cells send messages efficiently. One area that depends heavily on acetylcholine is the hippocampus, the part of the brain responsible for creating and storing new memories. Diphenhydramine belongs to a group of medications known as anticholinergics, meaning it blocks the action of acetylcholine. While this effect can help reduce allergy symptoms and promote sleep, it may also interfere with normal memory processes. Some people notice increased forgetfulness, difficulty concentrating, or mental fog after taking these medications regularly. Older adults are especially vulnerable because aging brains naturally produce and use acetylcholine less efficiently than younger brains. As a result, the same dose that causes mild drowsiness in a younger person may have a much greater impact on memory and thinking in someone over 60. This doesn't mean everyone should stop taking Benadryl, but it does mean that long-term use deserves a careful conversation with a healthcare professional. At number 8 are proton pump inhibitors, often called PPIs. These medications include well-known names such as omeprazole and Nexium, and they are commonly used to treat acid reflux, heartburn, and stomach ulcers. For many people, they provide significant relief and are taken for months or even years. However, long-term use may come with a hidden cost that many patients never hear about. One concern is that PPIs can reduce the body's ability to absorb vitamin B12. This vitamin plays a vital role in maintaining healthy nerves and supporting normal brain function. When B12 levels become too low, people may experience memory problems, difficulty concentrating, confusion, and even symptoms that resemble dementia. Researchers have also noted that prolonged PPI use may contribute to lower levels of magnesium and calcium. Magnesium is especially important because it helps support communication between brain cells and proper nerve signaling. Low magnesium levels have been associated with fatigue, mental fog, and reduced cognitive performance. The connection is not that PPIs directly damage the brain. Instead, the concern is that years of reduced nutrient absorption may gradually affect systems the brain depends on to function properly. For older adults who may already be at greater risk for nutrient deficiencies, this effect can be even more significant. If you've been taking a PPI for a long time, it's worth discussing with your healthcare provider whether ongoing monitoring of key nutrient levels might be appropriate. At number 7 is oxybutynin, a medication commonly prescribed for overactive bladder. It helps reduce sudden urges to urinate and frequent bathroom trips, problems that affect millions of older adults. While the drug can be very effective for bladder symptoms, it belongs to a class of medications known as anticholinergics, which means it blocks the action of acetylcholine in the body and brain. Acetylcholine is one of the brain's most important neurotransmitters. It helps support memory, learning, attention, and communication between nerve cells. When medications like oxybutynin block this chemical messenger, some people may experience forgetfulness, difficulty concentrating, slower thinking, or increased mental confusion. The challenge is that these symptoms are often mistaken for normal aging. An older adult may begin misplacing items more frequently, forgetting names, losing track of conversations, or feeling mentally sluggish. Family members may assume these changes are simply part of getting older, when in reality, a medication could be contributing to the problem. Researchers have become increasingly concerned about the long-term cognitive effects of strong anticholinergic medications, especially in seniors. The good news is that newer treatments for overactive bladder have been developed that may have less impact on the brain. Not every patient is a candidate for these alternatives, but discussing options with a healthcare provider can be worthwhile. For some people, finding a treatment that controls bladder symptoms while placing less stress on memory and cognition may offer the best balance between comfort and long-term brain health. At number 6 are statins, some of the most commonly prescribed medications in the world. These drugs are highly effective at lowering cholesterol and reducing the risk of heart attacks and strokes. For many people, they provide important cardiovascular benefits. However, some patients have reported memory problems, mental fog, or difficulty concentrating while taking certain statins, leading researchers to investigate a possible connection. To understand why, it's important to know that cholesterol is not simply something the body needs to eliminate. In fact, the brain contains a large amount of the body's cholesterol, where it plays a critical role in maintaining healthy nerve cells. Cholesterol is also an important component of myelin, the protective coating that surrounds nerve fibers and helps electrical signals travel efficiently throughout the nervous system. Not all statins behave the same way. Some are more likely to cross the blood-brain barrier than others, which has led scientists to explore whether certain types may have a greater potential to affect cognition in sensitive individuals. It's important to emphasize that research findings have been mixed, and many people take statins for years without experiencing any memory-related side effects. If you notice new cognitive symptoms shortly after starting a statin, don't stop taking the medication on your own. Instead, discuss your concerns with your healthcare provider. In some cases, adjusting the dosage or switching to a different statin may help, while still providing the cardiovascular protection these medications are designed to deliver. At number 5 are benzodiazepines, a group of medications commonly prescribed for anxiety, panic attacks, insomnia, and sometimes muscle spasms. Popular examples include Xanax, Valium, and Ativan. These drugs can be highly effective in the short term, helping people feel calmer, sleep better, and reduce feelings of overwhelming stress. However, when used for long periods, they may come with significant risks for brain health, especially in older adults. Benzodiazepines work by enhancing the effects of GABA, a neurotransmitter that slows down activity in the brain. This calming effect can reduce anxiety and promote sleep, but it can also affect memory formation, attention, and mental processing speed. Many users describe feeling mentally foggy, less alert, or having difficulty recalling recent events while taking these medications. The concern becomes greater with long-term use. Over time, the brain can adapt to the presence of benzodiazepines, making it harder to function normally without them. Some studies have found associations between prolonged benzodiazepine use and an increased risk of cognitive decline, although researchers continue to debate the exact nature of this relationship. What is clear is that older adults tend to be more sensitive to the sedating effects of these drugs, which can contribute to confusion, falls, and memory problems. Perhaps the most important warning is that benzodiazepines should never be stopped suddenly without medical supervision. Abrupt discontinuation can lead to serious withdrawal symptoms, including severe anxiety, insomnia, agitation, and in some cases even seizures. If concerns about memory or cognition arise, the safest approach is to speak with a healthcare provider who can determine whether adjustments or a gradual tapering plan may be appropriate. At number 4 are two medications that often escape attention when people discuss memory loss: amitriptyline and paroxetine. Both have been used for many years and remain common prescriptions. Amitriptyline is often prescribed for depression, chronic pain, nerve pain, migraines, and sleep problems. Paroxetine, an antidepressant in the SSRI family, is commonly used to treat depression, anxiety, panic disorder, and other mental health conditions. While these medications can be helpful for certain patients, many people are unaware that they also possess significant anticholinergic activity. As we've discussed earlier, acetylcholine is one of the brain's most important neurotransmitters for learning, attention, and memory formation. Medications with strong anticholinergic effects can interfere with this communication system. Over time, some individuals may experience increased forgetfulness, difficulty focusing, slower processing speed, or a feeling of mental cloudiness that can easily be mistaken for normal aging. The risk may be particularly important for older adults because the aging brain is already more vulnerable to reductions in acetylcholine activity. When medications further block this system, the impact on cognition may become more noticeable. Some research has suggested that long-term exposure to medications with strong anticholinergic properties may contribute to an increased risk of cognitive decline. Fortunately, treatment options continue to evolve. Depending on the condition being treated, healthcare providers may be able to recommend alternatives with lower anticholinergic activity and potentially less impact on memory and concentration. However, these decisions should always be individualized. Never stop or change a prescribed medication without consulting your healthcare provider. The goal is not to avoid treatment, but to find the safest and most effective option for both physical health and long-term brain function. At number 3 are antipsychotic medications, including commonly prescribed drugs such as Seroquel, Risperdal, and Zyprexa. These medications were originally developed to treat serious mental health conditions like schizophrenia and bipolar disorder. However, they are also frequently used in older adults to help manage severe agitation, behavioral disturbances, hallucinations, sleep problems, and symptoms associated with dementia or other neurological disorders. In some situations, they can provide meaningful relief and improve quality of life for both patients and caregivers. These medications work primarily by affecting dopamine, one of the brain's most important neurotransmitters. Dopamine plays a major role in attention, motivation, learning, movement, and cognitive processing. By reducing dopamine activity in specific brain regions, antipsychotic medications can help control disruptive symptoms. The downside is that this same mechanism may also slow certain mental functions. Older adults are particularly vulnerable because aging brains are often more sensitive to medications that affect neurotransmitter balance. Some individuals taking antipsychotics may experience increased drowsiness, slower reaction times, difficulty concentrating, mental fog, or worsening confusion. In people who already have mild memory problems, these effects can sometimes make cognitive decline appear more severe than it actually is. For this reason, healthcare providers generally use antipsychotic medications cautiously in older patients, carefully weighing the potential benefits against the risks. While these drugs may be necessary in certain situations, regular monitoring is essential. If new memory problems, confusion, or changes in thinking develop after starting one of these medications, it's important to discuss those symptoms with a healthcare professional. The goal is always to achieve symptom control while protecting long-term brain health whenever possible. And now we come to the number 1 risk factor on this list: not a single medication, but the combined effect of taking multiple anticholinergic drugs at the same time. Experts call this the anticholinergic burden, and many older adults may not even realize they are affected by it. Here's why it matters. One medication with mild anticholinergic effects may not cause noticeable problems. But when several medications are combined, their effects can add up. For example, an older adult might take Benadryl for allergies, oxybutynin for overactive bladder, and amitriptyline for sleep or chronic pain. Each drug may seem reasonable on its own, but together they place a much greater strain on the brain's acetylcholine system. Remember, acetylcholine is essential for memory, learning, attention, and clear thinking. The more this system is blocked, the harder it becomes for the brain to function efficiently. At first, the symptoms may be subtle: occasional forgetfulness, trouble finding words, difficulty focusing, or increased mental fatigue. Over time, however, the cumulative effect can become much more significant. Research has shown that a higher anticholinergic burden is associated with an increased risk of cognitive decline, reduced daily functioning, and in some studies, a greater likelihood of developing dementia. The danger is that these changes often happen gradually. People may assume the problem is simply aging, while the true cause remains hidden within their medication list. That's why this issue ranks number 1. It's not always one drug creating the problem, it's the combination. The good news is that medication reviews can help identify unnecessary overlap. By working closely with a healthcare provider or pharmacist, many older adults can reduce their anticholinergic burden while still effectively managing their medical conditions. Sometimes, protecting memory isn't about adding another treatment, it's about carefully re-examining the treatments already being used. We've covered 9 medications and medication combinations that may affect memory and cognitive function in older adults. From common allergy medications and sleep aids to bladder medications, antidepressants, antipsychotics, and the hidden danger of a high anticholinergic burden. The most important message is not that these medications are bad or that everyone should stop taking them. Many provide valuable benefits and may be essential for managing serious health conditions. What matters is awareness. If you or a loved one have noticed increasing forgetfulness, confusion, difficulty concentrating, or mental fog, it may be worth reviewing all current medications with a healthcare provider or pharmacist. Sometimes, a simple adjustment can make a meaningful difference. Most importantly, never stop a prescribed medication without professional guidance. The safest approach is always to work with your medical team to balance the benefits and risks of treatment. Now we'd love to hear from you. Have you ever noticed memory changes after starting a medication? Share your experience in the comments below. And if you found this video helpful, please subscribe to the channel and turn on notifications so you don't miss future videos on healthy aging, brain health, and practical medical insights. Thank you for watching, and we'll see you in the next video.